Please, you have the floor.
Thank you, madam. I am Peniel Malakar from Emmanuel Hospital Association, India. While listening to various discussions across various sessions, I was actually wondering, when I go back, what do I take? And especially here, as I am sitting here and discussing about HFA2, would that be repetition of HFA1, which actually did not trickle down to the local community level that well? When I talk about my organization being a healthcare institution, how we got engaged to disaster management is basically seeing increasing number of disasters happening across our community that we work. 70% of our hospitals are in remote areas. I moved my profession from the hospital administrator to a disaster management professional in 2006. The reason is why I would like to say a few things about the HFA2 is that this is the right time probably to really let the HFA2 agenda reach to the grassroots level. I never knew what is HFA1. And even when I already spent about 2 to 3 years in responding to disasters, I never knew what was HFA1. And I think this is the challenge and should be the mandate from HFA2 to make sure that it reaches down to the lowest level. We talk about communities being the first responders. And I am very sure in a population 120 million in India, 99.999% will not know what is HFA. I was surprised myself when I first interacted with disaster management organizations in a network in Delhi. Many of them were blinking about HFA, and we had to expand it to tell them that this is a platform where the global level commitment was made to reduce risk of disasters. And before me there are a few, in continuation with my VFL communication, I would like to really state here that we need to empower the local community, local NGOs, local CSOs who are never heard. To come to such level, you need to have a very good backup of international organizations, otherwise you are not heard, you are not even found anywhere. To empower the local organizations, why not, I would like to give an analogy of manufacturer to the end user of a product. If we reduce the channel, I think the product reaches to the end at a lower cost. I think a huge amount of administrative and other costs is merged into the huge funding raised by UN and many international organizations. I have the fancy of having international organizations as partners, traditional partners, to bring in funding to reach to the grassroots level. But I see many organizations struggles to do whatever good thing they are doing. And so empowering them by direct funding as a twin track approach. One could be continuation of funding through government agencies, but to avoid any conflict, why don't we have a common agenda drawn? The government agencies, organizations work up to the district level, which is very effective in India. They have district level and disaster management authorities right from the nodal NDMA. And they are doing very well up to the district level. Why don't we have the second approach? The United Nations or even international organizations approach the local communities. I was surprised to see the VFL survey done, picking up a handful of 11 organizations to give the views of 120 million people, and out of that 70% of people were suffering due to disasters and increasing frequencies of disasters. So reaching down to the bottom level is extremely important, madam. And HFA2 would be successful only when we really proactively work on a mechanism to reach to the lowest level. This is my only plea and request. Thank you. Thank you for giving me time.
Thank you so much.